exposed and have less chance of getting infected than other people who seem to get infected with 1 or 2 exposures. And the viral load, the level of HIV in your blood, to some degree predicts how quickly you're going to progress. But we really don't know what are the factors that predict how people do with this disease from the onset.
Well, you know, that was, I was just thinking of this more or less the same thing, though, because genetics, you know, looking back in family genetics, you know, maybe some people from Ireland, for an example. God bless the Irish. You know, maybe some of the Irish, maybe for an example, have a very high tolerance, a tolerant level to HIV and/or AIDS, and so maybe their progression is going to be considerably slower than an all-around American.
Now, some of the research we've done has shown that there are some factors, genetic factors, that can predict to some degree some of these long-term non-progressive studies that Dennis mentioned. But really, the factors that have been identified only account for the minority of the variability that we see. The one factor that has been identified in terms of preventing or being resistant to infection is a variation that occurs more commonly in people of Northern European Caucasian descent, and that's a certain receptor on the surface of the T cell. And if you lack that receptor, you're quite resistant to it. If you have the genetic mutation that you lack one of the 2 genes, you're what we call heterozygous, you're a slower progressor if you do get infected. But again, those kind of factors only account for a small amount of the variability. When I'm sitting with a person in my office who's been recently diagnosed, has T cell counts of 500, viral load of 50,000, I really don't have many ways of telling that person where they're going to be in 2 or 3 years without therapy.
Right, exactly. And you were going to pipe in?
Yes. When your T cell counts are under 500 back then, they put you on medicine immediately. And I became involved with HIV 101, you know, healthy eating, 8 hours of sleep or more, stress management, your medicine regimen, spirituality, and just going out and enjoying life each and every day and go out and help people with this.
Now, this is 2 important pieces of info that the United Nations health agencies are saying. You know, and again, I want to, after reading these brief statements, I want to again go back into the 80s because there's an awful lot of stones from back then that have not been yet discovered yet, maybe in full. Being able to look back at it now with 20/20 vision. The UN health agencies recommend, this is bizarre, I thought I'd never read this, but they recommend this as Wednesday, I got this from UN Health Department's website, that heterosexual men undergo circumcision because of compelling evidence that it can reduce risk of contacting HIV by up to 60%. What do you think about that as a medical doctor?
Well, I think there's 2 or 3 very large, very good studies that have demonstrated that. There's also biologic plausibility for it. There's epidemiological data. If you look at African countries and rate of circumcisions, there's an inverse relationship between circumcision rates and HIV infection rates. So, and also the inside of the foreskin has cells that appear to be very susceptible to HIV infection, and that tissue is removed during circumcision. So I think that it's an example of a prevention intervention that on a population basis is going to make a difference, but still individual people can significantly reduce their risk of HIV acquisition with or without circumcision. But there's a couple of big studies now that have shown the efficacy of this as an intervention.
Well, they had one group, and I can't remember this medical group in Africa, actually started this nationwide, or well, I guess it would be nationwide, study and survey and actually doing that to folks in their regions, and they did find that again, I guess that's in part where they're coming up with a 60% ratio, but that is a mind-blowing percentage rate of folks who do reduce their risk of coming down with HIV or AIDS. In another note, on the opposite side of the world, the Catholic Church, and we love our Catholic brothers and sisters, Of course, they stand against condom use within that church, contributing to the rise of HIV and AIDS in South Africa. A UN official told Reuters news agency. Some 1.7 million people in South America have HIV or AIDS, Reuters reported. The epidemic is quickly spreading up to 410,000 new cases in 2006, an increase from as many as 320,000 cases in 2004. Now, again, looking back with 20/20 vision back in the 80s, I know back then it was, people were just getting out of the free love state, the flowers and the roses and all this stuff going on. But do you think that if people were back then were more, Johnny on the spot more or less to protect themselves by using condoms and things like this, that it would have done something far better, far greater for the HIV and AIDS care and case management that we see today?
Well, I think if you look back at the data from the 1980s, gay men did dramatically change their behaviors. And if you look at the rising rate of infections, it started to come down in the late 1980s. And I think you did see, and people like Larry Kramer were screaming loud about responsibility. And I think once it became apparent that this wasn't, I think you have to realize, to put yourself back in 1980, the idea that there would be a virus that was sexually transmissible that would kill people was totally alien. Myself, as a physician at the time, I didn't think when AIDS first started that would be the case. But it certainly turned out to be the case, I think, and the mindset changed, and I think people did change their behaviors. I think people continue, though, not to follow the prevention messages that are out there, and we need to continually emphasize prevention.
Why do you think that maybe for a short period, open to everybody, but what do you think that maybe for a short period people did pay attention to it, but suddenly they just forgot?
After a while, people just, after years went by, people said, oh, the heck with it, it must not be an epidemic anymore, and they went back into their loose behavior of the 80s. Barebacking, unsafe sex, multiple partners, supposed to be monotonous, without using a condom. And the black community is hit hard because 25% of black men are infected with HIV and don't know it, and the women are taking a teetotaling from it. They're dying off. Men are on the lowdown, they're having gay sex, but they're not gay, get real,
Right.
Everybody just they lost their morals, It can't affect me, but it does.
How has it affected you, not just as a person with HIV and AIDS, but as a black man dealing with that?
As a black man, I go out. I'm trying to get involved in this group called Black Leadership on HIV. I do public speaking. I talk to people at Chicken Soup, and it's just like they don't get it. It doesn't. It doesn't have anything to do with them because. That's the mindset.
Now, let's talk just a second, because I know some of the viewers are like, what did he just say? Chicken soup? Well, of course it's good for the soul.
Right.
But
Chicken Soup Brigade is an organization that does help you with your health care, your bills, food, transportation, and we'll call. You can get tickets to plays and a symphony, give you a social life. It's a great organization.
Well, I think it's great, for anybody to be involved with it, especially, volunteering as you do. I don't know, there's, so much that can be said, that can be done, but I think that above everything or anything that anybody could ever say, action is, of course, most important. Now, looking back again, back in the 80s, and let's pop our head back in that window a minute, what was it like for someone back then that was infected? It's a twofold question. But for someone who was infected back then, knowing that the odds were definitely stacked against you back then because of the lack of research, the lack of medication that was proper, that would actually do something. And then as a physician, weren't you back there just pulling